2022, history was made. For the first time, Christian health workers united to implement a missions outreach at Gosa along Airport Road, Abuja. This included the Christian Medical and Dental Association of Nigeria, the Christian Pharmacist Fellowship of Nigeria, the Fellowship of Christian Medical Laboratory Scientists, Nigeria, the Fellowship of Christian Nurses, Nigeria, and Healthcare Christian Fellowship, Nigeria. The outreach was in 2 phases, a medical phase that held from the 10th to the 12th of June, and a surgical phase that held from the 24th to 26th June 2022. Gosa community is an indigenous Bagi community located about 10 minutes away from the Nnamdi Azikiwe International Airport. It has a population of more than 10,000. Its residents venture into small-scale farming and various craftsmanship. The community is a low-income settlement which has faced the ill effects of rapid urbanization. Gosa community is serviced by one primary healthcare center, which is poorly equipped and lacks the adequate human resource to cater for a community of that magnitude. Due to the high poverty level, the people of Gosa community cannot afford quality health care in the city center. The needs in this area are enormous, and the humanitarian crisis there is evident. The outreach did not only meet the needs of Gosa people, but also adjoining communities like Soka, Toge, and Kuje, some even as far as Nasarawa State. Prior to the outreach, the planning team surveyed the community and made a courtesy visit to the community leaders to inform them about the outreach. Banners and flyers were placed in strategic places in the community for the purpose of awareness of the community. Members of the community were interviewed and the challenges faced were highlighted. The planning committee consisted of 13 units which were in charge of different aspects of the outreach. There were multiple meetings, both virtual and physical, to align on the goals and ensure everyone was on board. Volunteers were trained by unit heads and technical assistants to carry out specific tasks.
Starting from receiving people registration, guiding them. I want us to know that it is a spiritual exercise. It is a spiritual matter. We are going to a strong man's house. I know that community.
There were multiple visits by different units for site mapping. The prayer unit actively interceded for the outreach day and night, before, during, and after the outreach. Through the outreach, it was evident that God is faithful and His love does endure forever. It was apparent that the effective prayer of the righteous man availeth much. James 5, verse 16b.
Units have been giving prayer backup for the outreach and also conducting prayer who needed it.
The registration unit collected data and registered every participant and every volunteer. This unit also entered data collected from participants. The vitals unit collected all the necessary vital signs: body temperature, pulse rate, blood pressure, height, and body weight. They subsequently triaged based on their symptoms and complaints and took note of patients presenting symptoms and complaints.
Having to interact with different people, different ages, different age groups, and taking their vitals. It's more the personality for me because I enjoy interaction with people a lot. And I've learned so much having to work with the nurses. Like, this is the first time I'll be working on artists, like, so I have to work with different health workers. So I was able to work with nurses and some other persons that are outside the medical sphere.
Consultants saw every registered patient, gave general consultations, and referred patients to other units like ENT, O&G, dental clinic, eye clinic, laboratory, and pharmacy, depending on what was best for the
We're
patient.
thankful for the opportunity, and we thank the kind of partnerships we have, and it's been working. We do not just see this in medical consultation as something that would last just for now, but we're seeing it as what will affect the future of healthcare in Nigeria. The kind of harmony we have enjoyed here, working with our lab scientists, working with our nurses, working with our physiotherapists, working with our eye technicians, working with the dental technicians, and everybody here. The atmosphere is so serene. The atmosphere shows a lot of love and support. And I see this as hope for the future of healthcare in Nigeria.
The Children and Adolescent Unit took the gospel message to children and adolescents. They also counseled and gave health and career talks to them before referring those that needed medical attention to the pediatrics unit. Sanitary pads and underwears were distributed to the adolescents.
I've met with children that even though they are sick, they are still very joyful, and it has taught me a lesson that regardless of the circumstances that we are in, we should have joy and we should be very grateful for life. One surprising thing, I didn't expect that I was going to have to talk about menstrual hygiene. In fact, I had to think about what I had to say, but I was so happy because there was a lot of things that they didn't know, and I was so happy to be of help and to change the world one child at a time, at least in my unit. And I also want to say thank you to CMDA.
The laboratory unit carried out investigations as requested by the consultants. This included hepatitis B and C, random blood glucose, malaria parasites, packed cell volume, urinalysis, and retroviral screening for HIV. The pharmacy unit dispensed different types of medications to patients who needed them with the prescription from the consultants. They also took inventories every day to ensure that the pharmacy did not run out of drugs at any point.
Pharmacists are enthusiastic, they are willing to work and are very cooperative. So they made my work quite easy and simple because, before anything, you find people organizing themselves and just doing the work with joy. So it's very touching for me. I really appreciate them.
The counseling unit was made up of 35 counselors who reached out to the patients one-on-one with the gospel of our Lord Jesus Christ. Some of the materials were translated into indigenous languages such as Hausa and was used for the evangelism.
Counseling team, we've been having one-on-one evangelism sessions with each patient. After they have gone through consultation, before they go to the pharmacy to collect their drugs, they pass through the counseling unit where they get to hear the gospel, and many of them have given their lives to Christ for the first time. Some have rededicated their lives to Christ, and some have been following.
The welfare unit distributed humanitarian aid like clothes, toiletries, and sanitary items. The unit's priority was the welfare of everybody present at the outreach, including the volunteers. All clothing items donated were washed and prepackaged according to gender sizes for the outreach.
The times that we had meetings, to the times that we called for donations, we got a lot of support from several organizations, including humanitarian services and others. We got donated materials from churches, we got from individuals. It was really massive, so massive that we didn't even think it was going to be, that we thought we would not be able to share everything. But at the end of the outreach right now, everything was exhausted. We had a lot of village community members to give things to. So during the preparation, we did a lot of sorting out of materials into several sizes for different genders and for children also. We also made sure that everything was transported down to the venue, and when the outreach started, we ensured that everybody we came across got something. At least everybody went home with something, and you really need to see the smile on everybody's face, both the children, the adults, the young ones, they were really, really excited.
The setup unit was made up of technical and media volunteers. Their duties included setting up the venue, which involved the mounting of canopies, arrangement of tables and chairs, ensuring that there was constant power supply throughout the outreach. They were also responsible for the transportation of volunteers and equipment. In addition to this, they conducted interviews, took still and motion images of the different segments of the outreach. 51 patients met the criteria for immediate surgical intervention and were referred for surgery. 14 of these patients were referred for eye surgery. The surgeries involved both minor and major surgeries. Some of the surgeries carried out were myomectomies, lumpectomies, herniotomies, etc. 44 cases were performed at the Primary Health Care Center, Gosa. 2 myectomies were performed at the Limi Hospital, and 5 pediatric cases were performed at Gibona Women's Hospital, and the eye surgeries at Tunsil Chanrai Eye Hospital, Abuja. Patients were subsequently booked for follow-up over a period of 2 weeks after the operation.
Our presence here, or just a short time that I spent from the perspective of surgery, was very, very much needed. And it's an opportunity that we are providing for the people of this community to be connected to the health system in such a way that they can benefit maximally or optimally from it. I only wish we could do this more often. But it takes a lot of planning and a lot of investment of resources, so we can't do this. But hopefully, by the grace of God, this will have ripple and cascading effect.
A remarkable part of the Gosa outreach was the featuring of the generations of CMDA Nigeria leaders spanning a period of 30 years. Dr. Paul Idoko Enenche, the senior pastor of Dunamis International Gospel Center, and his lovely wife.
Using that as a tool to reach out onto their spirit and onto their soul. So these are reach out onto their spirit and onto their soul. So these are ways that you reach out onto their spirit.
I was the last person to even, okay, and I had to guide her through, and she got her success of that.
It was just all of us working towards this common goal. So I'm just really thankful to have witnessed that.
So what stood out for me, the outreach, age gap and everything in different units. Another thing that stood out for me is the supply. So at this minute, it's as if so something comes up, we need this, we need this, we need this. And you're looking at the need and you're not seeing anything to meet that need. And the next point, someone just comes and say, for example, the biscuits for the children, where like that wasn't included in the budget, how do we do this? And somebody just says, how many cartons do you need? Wow. And it was provided. And if you see the videos from the humanitarian part, the amount of things we had to give out, it was awesome. So grateful for the supply. The planning team had a review meeting to discuss and document the impact, lessons learned, and the next steps for the Gosa outreach. This shows that irrespective of one's current specialty, there is always a part to play. We are grateful that God let us be a channel of blessing to the community. We are grateful to the over 350 volunteers. We are also grateful to the collaborators who played their part to make this happen. Indeed, working together at Gosa, we were able to achieve the goal of CMDA Nigeria, which is caring for the whole man, spirit, soul, and body.